Open enrollment for Medicare is from October 15th through December 7th. Many seniors have questions about these Medicare plans. Larry Vanderweg, administrator with Lindsborg Hospital, joins me today. Well, Larry, thanks for coming on the show today. Medicare time, enrollment time is just right around the corner. I want to talk about the difference in plans, the standard Medicare plan and so-called Medicare Advantage plans. Are they the same?
Actually, no, they're not. Medicare, as we know it, we'll call it traditional Medicare, is coverage provided by the federal government for care, typically for senior citizens. Medicare Advantage is actually coverage provided by private insurance companies.
Well, how are Medicare Advantage plans different from traditional Medicare plans?
You know, often in the way they are marketed, they may be marketed that they are the same, but in our experience, we've seen a few areas of where they're different. One is in referrals. You have a traditional Medicare, you typically don't need a referral. You can see whatever provider that you want to see, physician, PA nurse practitioner, whether that's as primary care or specialty care. With Medicare Advantage, a referral is typically needed to see a specialist or even with a primary care, that physician, PA or nurse practitioner needs to be in network with that insurance company. Another area that we've noticed some differences is in prior authorizations. You know, with traditional Medicare, we have rules that we need to follow if somebody needs a procedure or needs post-acute care like skilled care or swing bed, and we follow those rules. And if they qualify, we can, your doctor and you can receive those services. With Medicare Advantage, typically prior authorization is required for a lot of those services. And so, if you and your doctor determine you want that course of care, we then have to go back to the insurance company to get authorization from that insurance company. And it tends to cause delays in care. And sometimes they say no, that you can't have the care that you and your doctor feel that you should have. The third area that we've noticed is in copays and deductibles, or typically out-of-pocket costs. With the traditional Medicare, typically you have the Medicare, and then often we'll have a secondary insurance, and so a person typically does not have any out-of-pocket costs when they receive care. But with Medicare Advantage, you don't have that secondary insurance, and so there are copays and deductibles that often come into play with the Medicare Advantage plan.
So Larry, what would you tell someone that is considering Medicare Advantage plans for like the Lindsborg area?
The reality is I'm not speaking just for Lindsborg Community Hospital or even Salina Regional Health Center as a system. These issues are impacting hospitals and health systems and patients across our state and country. What I would say is, do your homework on, when you look at the bells and whistles that the Medicare Advantage plan may provide, like paying for other things that traditional Medicare doesn't. Also look at what the out-of-pocket costs will be if you are sick, those copays and deductibles. And also, think about if you need skilled care, post-acute care like skilled care or swing bed, will you be able to get those services? And finally, if you are considering a Medicare Advantage plan, I would encourage you, each person, to reach out to their local hospital and clinic to make sure that the provider of choice is in contract with that Medicare Advantage plan, so they can see the doctor, that PA or nurse practitioner that they want to see.
Larry, thank you so much for coming on the show and for some great information. And thank you for watching. For more information, please visit lindsborghospital.org and like them on Facebook.